So our next session is on virtual clinics and smart wearables. For this session, we have Dr. Veera Prakash, Palnivelu. He is the General Manager Business Development at the Chettinad Super Speciality Hospital. He has done a postgraduate in medical law and ethics from the National Law School, and his MBA is in healthcare management from the Indian Institute of Management, IIM. He is now he was earlier with the Global Hospital Group, and now for the last 5 years at Chettinad with business development. He is here as a speaker because primarily Chettinad has done an extensive use of virtual clinics based on the backbone provided by Tata Communications. Along with Dr. Veera Prakash, from the Acme team, we have Mr. R. Venkatanathan. R. Venkatanathan is a senior manager in the Acme projects team. He has an MBA and a stint of over 12 years in healthcare. His forte is helping hospitals to understand their market better and develop specialties and services that best address these. He is in charge of our company's entire feasibility study and project reports. He's been talking about virtual clinics as a good marketing platform, so this is his opportunity to explain that. Over to you, Venkat, and over to you, Dr. Veera.
Indeed, it was a good session.
Virtual clinic as a solution, let us talk about directly, because let Venkat come in. Venkat wanted to share us what a virtual clinic would bring in. But let us talk about Tata Communication journey as in virtual clinic. We gave the brief about what is Tatacom and why we went in, why we are in this business. So we will not discuss about that at this moment. Let us directly come to a topic, virtual clinic. Was it effective? I believe COVID has taught us, yes, it is effective, both from doctors and Dr. Veera Kumar would like to, if I ask Veera Kumar 2 minutes, a question about, from a doctor before COVID and after COVID. Sir, is that a virtual clinic adoption or as a virtual consultation adoption? Is it, what type of percentage that you wanted to talk about, or you want to, from an experience point of view, what is your acceptance level, sir, as a doctor? Overall and from your group?
The healthcare beyond the COVID era needs to be deeply intervened through an effective strategic plan. And that case is this telemedicine or virtual medicine, which has spawned into a healthcare digitized ecosystem, has done the best way. So it has given us top priority to do in listing in the key hospital setups. Like we have done across around 600 plus consultation through various remote units. And where our referral base from the remote units have gained a lot in this COVID period, related to COVID and during this COVID era. So this new age technologies for a futurist healthcare has given us a top priority, which has been a good for a bridge. It was a good factor for to bridge the gap.
Wonderful, doctor. So, doctor, now you all have converted this into an COVID era. So, along with COVID era, we also called it as a digitalization era for Indian healthcare industry. We would not compare any other country. India, 130 billion population. Are we good enough with this, with the required doctors available for us to consult? Do we have a good enough information for the upcoming juniors to know about what is the senior has treated? Do we have enough nurse for attending? Do we have enough protocols to follow in any consultation process, including digital prescription? Do we have? So this all question was answered during the COVID. Every question had no, 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 no. So are we, that is why it's called COVID era. When we say no, okay, the COVID is going to stop. Doctor, one more question. When the COVID is, let's assume that, and we pray for it, that the COVID pandemic is going to move to an epidemic, and we say this is going to be a normal norms. Do you really see this virtual virtual clinic is going to continue? Do the doctors and healthcare industry see this as one of a tool to support and improve healthcare in India?
Yeah, that's really true. The thing is, like before the period of COVID era, even the COVID era, it has given us a lot of advantages in terms of healthcare industry booming. The earlier era or the pre-era of COVID, the early stages of COVID has not given a much of boom to the healthcare industry. Once the things are started to settle down with a lot of transformation from the government point in terms of lockdown and other things, what has happened is that has restricted the flow of people in all industry levels. Majorly, it has hit a backdoor in terms of healthcare industry too, where the people stepping into the hospital for a OP was drastically less. Even to have a differential diagnosis, to have an investigation done, or to a lab or to get a pharmacy samples or pharmacy things for their basic evitables, it was affecting a lot. Then it was new to this era, so even the government was slowly into a start phase at the initial stage of the first wave, and they've given a little bit of lapsing in terms of functioning of the healthcare industry. So the pharmacy was functioning 24/7. Even the investigations and few of the hospital was functioning 24/7 without any lapsing. So that is one best thing which government has taken an initiative towards it. Even after that, the people are restricted in terms of commuting. So this era has given a digital boom to the healthcare solution, and to upgrade to any organization or a healthcare industry, this telemedicine or virtual telemedicine has been coined into a virtual medicine. It's nothing but you can feel the factor, like even we have transferred from 3G to 4G to 5G. The same thing from a telemedicine concept to a virtual concept is major boom to the industry. It has given a differentiation in a very drastic way. So it has mainly incorporated the telemedicine concept to the next level. So the transformation has been done from an online health era to a better digitized ecosystem. So this has given us a best description for all the OPD prescriptions.
Thank you, doctor. So, doctor, what you are, if I have to take away from your speech is, I understood that as an healthcare industry in India, we need to serve healthcare industry primary responsibility to needs and must to serve that demand that is exist, just not because of only revenue generation, but as an humanity friend. That during COVID, as a frontier, you all as a healthcare service provider, including doctor and nurse, has faced a major dangerous on your life threat. So as an industry or a technology provider like us, we cannot sit idle. So the technology that we're talking about, it could be of various mode, but what are we trying to say? This new norm after this COVID, digitalization in healthcare is not just good to have, it is becoming a must to have, and we need to emergently address it. Why? This is a fear which is instilled in every human being right now from a child. Now, without mask, we don't even, I don't know whether we might start sleeping with the mask also, right? Because now certain things were not mandatory earlier, but become mandatory. Like, for example, mobile has become mandatory right now. Everything has shoes, slippers, dress. If we talk about few age, but this COVID has given a big hit to the digitalization era, and we need to focus on it. With that, we will focus today and this particular time period on a specific topic, which is called a smart EOPD, virtual clinic solution. When we say smart, leave that English version out of it. But you think about, as doctor clearly stated, what is the difference between a telemedicine and a virtual clinic? Let us consider virtual clinic. What is to be a virtual clinic? When you, as any patient comes to an hospital, what they want technology in place by which a doctor, right? We need to think about from a doctor point of view, because he's going to see multiple patients at an instant, because we want to bring in efficiency in doctor. The ratio that right now we have, I may be wrong, which is about 2,000 versus 1, which is 1 doctor versus 2,000 population. I believe that is one general vision I'm talking about. The measurement, the ratio for specialists would be much more. So with that, how do we focus a technology which can bridge this and bring in efficiency? That is when Tata Communications started in 2012 this product, but we had a bad hit, which after COVID, we saw the demand has increased. The demand has increased because the push for the health industry that this is going to be a new norm, which we need to adapt. What all it has a various feature. The various feature, not just on the software, it also ensures that you have a telemetric devices which can measure the patient vitals. It can transfer your heart information. When you say heart information, ECG, and your pulse and your heartbeats through a digital stethoscope, through a digitalized your ECG parameters. So with all of this right now, Glow Hill, which is a Tata Communication healthcare brand, has brought in a virtual clinic solution with 3 set of, one is pre-consult, during consult, and post-consult. Why this 3 model is required? For basic screening in a mall, or in a remote places that you wanted to send a remote lab sort of and do a monitoring, a pre-consult is enough. Pre-consult is something a nurse sitting at your virtual clinic, measuring a patient who have come in, taking their basic personal information, then their body vital information, then if there is any test need to be done, connected with the problem that they come up with, capture the symptoms and the problem and the challenges that they're facing through, move that, push that information to a consultation. During consultation, the doctor is focused more. Why he is focused more? Does he has some relevant information when a patient comes through? Like a patient in a live environment goes with the prescription, goes with the registration card. Here, the doctor will have all the information available with him during the consultation. Despite that, the doctor still wanted to check his heartbeat because doctor wanted to hear it. He might have a recorded audio, but he wanted to hear it back. So he has still enabled with few features, like again, he can hear the vital information. He can hear the stethoscope, it's a heart information. And if you want to redo a ECG during the life to see the pattern by various, increase your breathe, decrease your breathe, put some pressure in some of the pulse and see, that is possible. Post-consultation is a module like a pathology, but it's a small version of pathology. Why we have to do all of this at one place? This is when an effective virtual clinic solution is done. Why? The better, which is called your P-square. You be more proactive and predictive. If these informations are aligned together and the doctor sees it as in one clinical, he would be able to prescribe the medicine. And when he prescribes at the right time, the prevention factor can only come in when you do a proactive monitoring. Otherwise, you will not be able to do this particular solution. Along with whatever I spoke about, it provides an effective virtual clinic management, not just giving a video and audio consult, not just connecting only the vital parameter. It also enables a doctor pool-based solution by which a doctor sitting, if you're creating a hub for a primary healthcare, for example, during this COVID, the demand was more where the panic button was pressed, many patients are panicked to understand my 1, 2, 3, 4 symptom. Am I COVID or am I having any other issues? Where was the doctors? Because the doctor had a tool, their mobiles were ringing, their chats were piling up. They were not able to effectively answer, they were not able to record. They do not know this patient status. Even their own personal patients, which is called the family patients, they were not able to get the records in place. Panic. Is this the first time or is it going to be the last time which we are going, this humanity is going to see this in a pandemic? No, maybe or might be based on a trend. It can keep coming. Can we get it ready? Yes, this is the time that we have to get ready with a set of tools, solution providers in place for a doctor or for a clinic or for an hospital to give a solution overall for government to ensure that they govern. What happens to this particular terminology, which is called a policy, procedure, governance, which government is going to come up with? Unfortunately, Tata Communication Global was earlier working with National Health. Earlier, it was a Ministry of Health. Then now we are continuing with National Health Authority after this COVID, because they wanted to make sure that digitalization is focused, patient-related informations are properly in place, a clinical flow has been taken care. So this governance body, we are working with them in our product, are more aligned to it. So these service providers, the healthcare service providers, can take a cloud-based solution, which is, of course, we talked about secured, etc. Plus the device and end-to-end solution. Tata Communication Global platform provides an end-to-end solution, not only just a cloud application, it also provides a devices as a bundled solution where you can rest assured, including the operation end-to-end service being taken care. With that, I would like to hand over to Mr.
I think Venkat would like to comment. Venkat,
Yes.
with your opinion about how the market would require this.
Yes, sir. I think there will be a huge take from the corporates because still, as Mr. Ramdev rightly pointed out, there is the divide between the rural-urban, the gap. The gap is huge where in the rural side, the demand for the specialist is very high. So in that, Mr. Ramdev, do you think that the corporates will be playing a major role in taking healthcare to the rural places using the virtual clinics?
I think can we ask this question to Dr. Veera Prakash? Because
Yes, rightly said, sir.
yeah,
Yes,
Chettinad,
yes.
Chettinad must be doing a lot of work with corporates. Dr. Veera Prakash, what would be your take on taking this corporates to the corporate route for them, a CSR or any other activity? Dr. Veera, over to you, sir. Your voice is, yeah. Go ahead.
Associated.
Yeah, we can hear you.
They are locally associated with Parasudan. Yeah, I've been operating an occupational health center at Ramanujam IT Park, which is there at the OMR building. In that area, like many of the access of the carpets has been taken care of at the basement of the occupational health center, where they can check their basic things like in terms of their vitals and their temperature check before they enter into their workforce. So mostly the COVID era, as I said rightly, it has come down to a lockdown period, and where the restriction of 50% of the people are employed over the all corporate sector. And the people who are stepping into the corporates, they need to have their vitals checked. As it is rightly said, like the kiosk or the one-headed kiosk that really matters in terms of the temperature analysis and the vital checks, and the quarantine centers, where we have used in the remote monitoring in terms of corporate operators, like where manufacturing segment in terms of corporate marketing, like where they are operating on 24/7 without any lapsing. The government have given a blue mark to green mark to run across the manufacturing segment. So any person who have been ended with the increased temperature or the difference in the vitals, they have made them to go for a quarantine center. That cases that this health kiosk is really helpful, where it senses the body temperature. Along with that, the IoT has really helped out in terms of monitoring the oxygen. Saturation of oxygen is also being monitored across. That is really work in terms of corporate market.
Okay. Venkat, does that answer your question?
And remote access also, it was really a good across in terms of 100 kilometers belt from Chennai city has been remotely monitored through this virtual clinic. Just really help us a lot.
Thank you, doctor. Thank you for your detailed explanation. One more thing, doctor. This virtual clinic, we having all those parameters. How it is helpful for the initial diagnosis for an emergency patient? Emergency in the sense he can be having an MI or a stroke. How it is helpful in those contexts?
So the thing is, like during our remote monitoring system, it takes at least 15 to 20 minutes for our ambulance to step into a place. When we get a call immediately, when we have ignite to the ambulance to starting from our place. To reach the place, it takes up to 15 to 20 minutes during this traffic at Chennai city, minimum 20 minutes. In that cases, yeah, the basic things need to be monitored. So what we address them is, if we try to see a person is closest to our remote area, we'll ask them to go to the remote area where a qualified nurse is there to have their basic checks done before the ambulance steps into that particular place. And we'll ensure that the vitals has been monitored through our virtual clinic setup at our emergency. Our virtual clinic is being addressed in the room which is closest to the emergency center, which is at the front desk of our the front entry of our hospital. Why we have more concern to this is at any given time, 24/7, the access to the emergency will be there, and the emergency physician will be there at 24/7. So the specialist might not be there after the office hours or after 5 o'clock. Only the evening clinics will be running across. So the emergency system need to be activated at any given time. So this blood oxygen monitoring, blood pressure monitoring, and the rapid test and the urine analysis gives an intro for patients to get into it. Initial lab investigation can be ignited. So when a patient steps in, the TAT, the turnaround time will be very less. That has really helped us in terms of TAT.
What sort of qualified paramedics would you need at the virtual clinic? Would just a qualified nurse do? Or you need an MBBS
qualified
doctor?
Nurses. A registered qualified nurse 24/7. If it is going to be operated 24/7. If it is going to be operation only from 8 a.m. to 8 p.m., at least 2 nurses on 12 hours basis is more than enough. And as we are going to have an end-to-end care system with us, and we have been officially tied up with them. From here, it is around 450 kilometers from Chennai to Madurai. A place which is at the remote area of Madurai, even being owned by us. So there only registered nurse was there. So our Ignite system has been on over here near the emergency care center. So our emergency physician can give the instruction to the registered nurse to take care of.
Okay. Yeah, Venkat.
Yes, thanks, Doctor. Thanks, Dr. Veera Prakash. Another question is, do you think that with all the annual health checks being done to the corporates and all the employees, do you think that in the future, the model would be these annual checks will be done mostly via virtual clinics? So that in another question, the second question is how the provider can improve the patient experience in those contexts. So can you explain that, Doctor?
Yeah, early stages, the mobility clinics are the mobility lab investigation was not done. And because of this, the time factor, and because of the restriction in terms of patients stepping into the hospital only for an investigation setup, during the period of COVID, the patient has been exposed in a multiple ways. So, for example, when it is going to be a mass health checkup, the patient needs to step into all the departments in terms of radiology, in terms of lab investigation, in terms of stepping into the OPD of the doctor after their reports. So this period will really help in terms of the period of booming is being coming across in different ways in terms of healthcare industry. The ailments can be easily found out at the initial stages and can majorly address the major ailments, and secondary opinion clinic really happen up on boomer side in terms of this virtual clinics. And apart from that, as you rightly said, the AI is booming across in India and in the worldwide. There may be a place where the mass scale checkup will be not a place to where the patient needs to step out and needs to step into the hospital to have their mass scale checkup done. There was a recent video which has been booming across in all WhatsApps and in Google where Sundar Pichai says by having your eyeball movements checked and eyeball screening can be done, and where it can predict your the chance of diabetic, or it can predict the chances of having your heart disease ailments can be identified. The AI is booming across. So at this moment, if it is not so, even at the early upcoming near future, it will be this.
Dr. Veera Prakash, can we just take a question from the participants?
Please.
There is a common question which two people have asked, Manpreet Kaur and Mr. Atmala Suresh Babu, about this placebo effect and the touch and feel. Is that missing so much in a virtual clinic? The doctors, touch and feel of the patient, or is the nurse able to compensate to some extent? What would be your take on that?
So the thing is, the feel good factor or the touch factor is so vital in terms of dermatology, in terms of gastroenterology, in terms of the urology. And not only that, even the patient having a factor that at one given point, just meeting a doctor only through a video consultation or a virtual consultation is not matter. I need to feel a factor. This really happens up in our remote centers. This can be offset by our registered qualified nurses. A doctor can ask the nurse to ask them to palpate the scenario and ask the patient to touch the point where they exactly feel the pain, and a nurse can assist for themselves. But still, there are a lot of more ways to go into the feel-good factor where a doctor can feel it across. At the early stage of telemedicine, even the heartbeat of the patient was not known. But by this virtual clinic, the murmurs and the sounds of palpitation can be easily identified by the doctor. The science is booming across. I think that no matter this will be done. And dermatology, dermoscope has done a better way in terms of identification of this. And otoscope has done a better way. I think the feel good factor or the feel of the patient or physical examination can be done over a time. It shouldn't be a factor now.
So the intervening nurse is a major factor in differentiating a virtual clinic from a typical teleconsult you do it from home. At least there is a medical professional.
Nurse accordingly.
Yeah, we need it. Exactly. I think we have come to 5 o'clock, Mr. Ramdev. Can we move on to the next session? Venkat, do you have anything else that you would like to quickly take up? Or Dr. Veera Prakash, anything that you would like to mention, or can we move on to the next?
So we can move.
4 or 3 years back, we are able to sign up an agreement with Glow. There were a lot of pros and cons, but now the cons have been reworked to it, and the hospital is getting a massive benefit from this virtual clinics. So that should be a problem.
Thank you very much, sir. I think your Chettinad would be a model for us to show to. Thank you, sir.
Thank you.
Thank you very much, Dr. Veera Prakash.
Thank you, Veeraji.